dental practitioners are in a meeting and they are yet to decide whether or not they will agree with this decision for co-payment to return in view of claims from the NHIS that have not been paid. Matilda, the guys with our health desk, and she's been monitoring the story, has details for us this afternoon. Matilda, good afternoon. You've been speaking to the society on this issue.
Yep.
What is making them have this meeting to take a decision on this matter?
Yes, for the society, they have gotten to, let me say, a breaking point where many of them are beginning to fold up. Others are also being chased by the banks and all that. So they've reached a point where they no longer can take it from the NHI. So the only alternative for them is to return to either the cash and carry system or go with the co-payment, where the patient will be made to pay half of the bills and then NHI cover the rest. Already we know that some health facilities only the NHIS only covers consultation fees, so medical patients are made to pay some of these bills. So that is the point where the association is saying its members have gotten to, that they need to take this decision, but this decision would only be taken after their meeting with the Health Insurance Authority
to see how the payments will be done.
Exactly.
Okay, Matilda, just hold on for a minute. Let's now speak to the president of HISPAG, Frank Toblu. Good afternoon to you, sir.
Yeah, good afternoon, and good afternoon to the cherished listeners of your wonderful station.
All right. Now, we've heard of some hospitals that have already started considering co-payment. Has that come to your attention, and how widespread is this situation?
Honestly speaking, the members of Health Insurance Service Providers Association have actually not taken any decision of that nature, except that I had a call this morning from one of the providers in the Western region, Takwa in particular, asking the way forward, because he had rumors that some providers are charging money from the people who hold a health insurance card. And I indicated that, well, that has not come to my attention yet, except that they are now informing me of the situations prevailing. So, like I said, it's not something that leadership of HISPAG has taken a decision that members should charge money from the public when they present their cards to the health insurance accredited facilities nationwide. Like
okay. Now, this issue of unclaimed, unpaid claims has been a revolving matter. How bad is it now? Is it that the NHI still owes HISPAG a lot of money?
Presently, the situation is we've had a memorandum of understanding with the National Health Insurance Authority. Now, the position is that they're supposed to make a good payment of the outstanding arrears, and then subsequently they will make payment on monthly basis. That is the understanding we've had with them. And I must say that so far, on monthly basis, yes, they have been making payments. This morning, when I got the news from Takwa, I quickly find out what was happening from the health insurance head office, and I was told they were making ready to make funds available latest by Wednesday to the healthcare providers nationwide. That is what I am told. So that is the prevailing situations at hand.
Okay, so if there's some news coming in from the NHIA that indeed payments will be made for the claims that have not been paid, what are you telling your members to ensure that we don't see patients walking into hospitals and being told that, well, you have to pay part for the health service you're asking for?
I would want to strongly suggest to all members of HISPAG nationwide that anybody who comes with a health insurance card should receive it until they hear from the leadership of HISPAG otherwise. But for now, no one service provider should go outside the normal situations and do anything untoward.
But am I to understand that if the NHIA by Wednesday does not pay up the monies which you're asking for, we will see the situation happen?
You see, my brother, where we are now as a nation, we have a very serious challenge at hand. Any slightest attempt by any group of society, especially healthcare service providers, to withdraw service, we have seen life lost every now and then. So, for us as an organization, we would want to strongly use every necessary legal means or possible dialogues to ensure that whatever that they owe, they pay it rather than service withdrawal, because that has not helped us as a nation over the period. Now, I can recall that when GMA, Ghana Medical Association, was on strike, we had a number of people losing their lives, and we counted 500, and that was disputed over by a certain group of people, but we still stand by that position that if we count, we will have that number. Now, when cholera broke out some time ago, because of certain conditions that prevailed, pharmacies and medicines were not at pharmacy of the various facilities. A lot of things happened. So going forward, HISPAG has one important factor, that we provide quality health care to the people of this country. So we are very cautious about our actions. But the fact of the matter is that when providers are pushed beyond a certain limit, that is when these actions come. So now, once we are getting on monthly basis, our position is that we will strongly demand some amount of money to cushion the providers so that they will be able to pay medicines and then continue to have some reserve to take care of certain medical consumables. That is our position. So we'll be dialoguing aggressively.
So you are dialoguing, and I get that. But inherent in the point you're making is that if the monies don't come, then it is out of your hands. You will consider withdrawing your services.
No, immediately, if the money doesn't come, we will find out reasons. And if reasons are reasonable, then we would. If reasons are reasonable, fine. If the reasons are not reasonable, we would then advise ourselves the best way to go. We would have to seek the redress from the minister. We have to seek a redress, possibly even going to the parliament. These are various options that are available.
That you will consider.
The last option should be withdrawal of service.
Okay,
the last option. For now, that is our last option.
Mr. Toblu, give us an understanding of how much exactly HISPAG is owed.
I am unable to give you an exact figure because as every day passes, the amount increases because facilities are providing services and submitting.
So at your last check, how much was it?
At our last time, it was 540
million Ghana cedis.
Million Ghana cedis.
Okay, all right. Thank you for your time. Frank Toblu is the president of the Health Insurance Service Providers Association of Ghana. Let me return to the studios and speak to Matilda right now. Matilda, we know that for the Society of Private Medical and Dental Practitioners, they are also owed. How much are they owed? For
now, they couldn't give a specific, but what they told me is that for every month, most of their members take around 28 million cedis. So when we calculate that, when we divide that by 7 months, then that should give us the total figure of what the NHI owe them. Okay. But the president told me, Dr. Isaac Morrison told me that it was just last week that some of their members received their last year July's payment. So they are still waiting on the NHI to make the other payments as well. So we can take a listen to him.
Are owed from July. Some have just received July, others are yet to receive July. So for August, September, October, November, December, technically everybody is owed that amount once the person has already submitted those claims. And then obviously January. I'm saying January because the contract with them says that payments will be made within 90 days of submission of claim. And so it could be the first day or the 90th day. So for the purposes of, just argument, we say the 90th day. So that means technically from July or August, include up to January this year, it's all outstanding.
So how are your members surviving throughout all this period?
Some have folded up, that is one. Others sought interventions from their bankers by way of asking for overdraft facilities, etc., in the hope that at least there will be some regular payments so that they can offset. But unfortunately, there has been some hiatus in the sense that the payment did not really follow and go according to plan. And therefore, these overdrafts, you know how they work. Once you don't pay within period, then there's a penalty slammed on you. And sometimes these penalties have also literally wiped out whatever these people were supposed to also get. And they've gone into bankruptcy.
Looking at the position where your members find themselves, then it all puts us in a situation where we are likely to return to the cash and carry system. I'm
afraid so. Unfortunately, nobody wants that system to happen. Nobody wants that.
Is there an alternative you are considering?
You mean alternative for my members?
Exactly.
There are several plans that one can think of, but as a president, I can only take mandate from my membership. For now, they are saying explore all avenues to get us arrears. In fact, they are even talking up to December. Explore all avenues and get us the arrears up to December. And I'm sure, I have a meeting again this afternoon with NHI, and we'll see how it goes.
What are your members saying now? Because I know some health facilities, for now, the NHI only covers consultation. Is that the position of your members too?
Well, the position of my members, as at the time we had that, shall I say, resolution passed somewhere in February, was that we should be paid all our arrears by the end of February. Failure, then we resort to cash and carry. Immediately, we had some intervention from NHI that they were going to streamline things for us. So obviously, like kind of having a fraternal relationship with them, you say, okay, fine. If you say you're going to solve, let's wait and see what can happen.
Right, so Matilda, for the National Health Insurance Authority, I'm just wondering, you've been trying to get an understanding from them as to what's happening, why we're seeing all of this. What did they tell you?
For the National Health Insurance Authority, what they are saying is that there's already an ongoing process to pay some of these claims, but there is an outstanding issue where he mentioned that Seloma Dunu, the public relations officer, he mentioned that some health facilities, their mandates have expired. What gives them the right to give healthcare to NHIS bearers? Some of them need to come and renew their mandate. Until that is done, some of them cannot be paid. So I'm sure that is what is eating into the private society and HISPAG as well. Because for the Society of Private Medical and Dental Practitioners, they are also raising concerns that they are being sidelined. Because it appeared all of them, the quasi, the public, and then the faith-based facilities, most of them, almost all of them, have flouted this directive where they are supposed to renew their mandates, but their arrears are being paid. Much attention is being given to them, but for the private society, they don't have that. So I spoke to the president, and he has been raising some concerns about this too as well. But this issue of the NHI is also raising concerns about the fact that some members haven't renewed their mandate, I should say. That is also accounting for it. That is the reason why at some point they have to withhold some of these payments for the proper thing to be done before the issue.
Have you checked whether both public, private, quasi-government, everybody had at a point in time not renewed their mandate, their contracts? That's all I'm saying. We had all not. It is not the case that, for example, maybe Mamobi Polyclinic or Fanchiniko government hospital had renewed. All had fallen short. So but you were exactly. All had fallen short.
What would make the NHI do such a thing?
Well, you have to ask them. That's unfortunate. That's unfortunate. And the posturing of some of their members in authority makes it as though the private sector is not wanted. If it's not wanted, let's have it. Let's have that understanding. Then we know exactly what to tell our members, how to move forward. But I can assure you that no government, no country has succeeded in delivering health care without the active participation and involvement of the private sector. In fact, some countries are driven primarily by the private sector. So therefore, if there are problems, let's all sit and find amicable solutions to them. but you don't strangulate the people who are already on the floor dying. You don't do that.
So what is the ultimatum that the members are given the NHI?
Well, I will shelve that for now, because at least someone has said, come, let's talk. So I'll go and talk. And then we'll know how to move on. Because once the person has asked that, please come, let's find ways and means of solving this problem, it is important that I obey that and give that respect. So definitely I'll go. Today, tomorrow, yes. So once we finish, if there's still the room to go, definitely I'll go. Otherwise, tomorrow is there. It's another day. We'll sit, we'll dialogue, we'll find a solution to it.
What then happens if your concerns are not addressed after these meetings?
If concerns are not addressed, then obviously, for sure, we'll have to go by what we think would solve our problem.
And what do you think will solve your problem?
Several things can happen.
Such as?
I don't want to really give those issues out, but let's wait and see.
So you can see clearly that for all these bodies, HISPAG and the Society of Private Medical and Dental Practitioners is simple. Pay us our money, then we can revert to ordinary service. Otherwise, co-payment could return. In a separate development, the 37 Military Hospital has denied claims that it is partially charging patients who come for treatment there. A notice purportedly pasted on the walls of the hospital indicated that patients would be expected to pay part of their bill whilst the NHIS takes up the rest. And Matilda has been following on this story. She's actually been to 37 and has the details. Matilda, what explanations did the management give you on this matter? So according to management, last week Friday, they met to discuss the way forward with regards to outstanding arrears by the NHI. So it's one of the decisions they were considering, whether to go with co-payment or for patients to pay part of the money for NHIS to take the rest. But it wasn't a decision that management took. So they were surprised to see stories making rounds that they have returned to co-payment system at the health facility. So they actually took me rounds. I spoke to some patients who indeed admitted, especially at the maternity ward, because they are those who heavily rely on the NHI. They have some concerns which we'll be listening to, but for the management, it's not one of the solutions they are considering now, though there are some outstanding issues with regards to arrears by the NHI. So just for clarity, just before we hear from the patients, for management, they are owed money by NHI. Do we know how much they owe? They won't state how much it's being owed, but they tell me that yes, there are some outstanding arrears that needs to be cleared, but it's not something that will push them to return to a co-payment system at the health facility. Okay, let's now hear from some of the patients Matilda has been speaking to today on what their experience has been visiting the 37 Military Hospital.
I've been coming here for I think 4 months now. It doesn't cover the scan. I did my scan outside 37. I bought the drugs here. I paid for everything. I gave them the card, but they didn't accept it. So I paid for my drug, but with the consultation, the NHIS covers it. And then, well, yes, I did a lab test and they didn't charge me anything. So for the lab and the consultation, I didn't pay for that. Yeah.
When you come, they have to verify you and make sure that you've authenticated yourself that your NHI is working. Then they'll give you a sheet. You give them a photocopy of your NHI. They'll give you a sheet and go and see the doctor. You join the queue and see the doctor. I've been to polyclinic before for my first delivery, and it was working. And I think about 3 weeks or a month ago, I sent my daughter, my small baby, to Achimota Polyclinic, and I didn't pay anything. It was only some of the medicines that they said I didn't have, so I have to go to the drugstore and buy. But some I was given, and I didn't pay anything for the whole consultation and everything. It works very well.
Right, so those are some of the patients at the maternity ward of the 37 Military Hospital speaking to Matilda Omega. Matilda, thank you. Thorough job you've done today for what's happening with this co-payment issue at the hospitals in the country today. Thank you. Thank you for those details for us. That's for health today here on The Pulse. Now, a struggle...